and welcome to the training session on updates to weekly COVID-19 vaccination data reporting for long-term care facilities. My name is Elizabeth Kalisle, and I work with the Division of Healthcare Quality Promotion at CDC. Next slide. Before we begin, as a general reminder, please contact CMS with questions about reporting requirements using the email addresses provided on this slide. Next slide. The objectives for today's webinar is to review the simplifications and additions to the COVID-19 vaccination data collection forms. Towards the end of the presentation, we will review frequently asked questions and share helpful resources that can be found on the long-term care facility component website. Please note that the slides from today's session will be posted to the NHSN COVID-19 vaccination website in the coming weeks. The form changes that we discussed today will be available to users as of May 30th. Next slide. Let's start with an overview of how the weekly COVID-19 vaccination data collection forms have been simplified. We will begin with reviewing the current version of question 2 on the forms. To simplify reporting, questions on reporting data by vaccine manufacturer for primary vaccine series will be removed. Next slide. The image shown here is the new version of the primary vaccine series questions. As you can see, the new version has been reduced to only 2 questions. Rather than reporting by specific manufacturer, facilities will report data for question 2.1, covering individuals receiving only 1 dose of a 2-dose primary COVID-19 vaccine series. For question 2.2, facilities report on individuals with any complete primary COVID-19 vaccine series. Next slide. The screenshot on this slide shows the current version of question number 4 on the weekly COVID-19 vaccination data collection form for healthcare personnel. To simplify reporting, the 4 questions about vaccine manufacturer for additional doses and boosters will be removed. Next slide. Rather than reporting by manufacturer, you'll report only the total number of individuals who have received any additional or booster doses since August of 2021. Next slide. After obtaining feedback from facilities and stakeholders, and as the COVID-19 pandemic response needs change, the vaccine supply questions will be removed. Next slide. So now we'll review new questions that are being added to the form in this release. For long-term care facilities, this is what the new data collection form will look like for residents. On this slide, you will see the changes and updates indicated by the green and purple boxes. As we just reviewed, we removed the requirement to report vaccine manufacturers from questions 2 and 4. Questions 4.1 and 4.2 are new questions added to the resident form on the number of booster doses received. And question 5 is a new question added for both residents and healthcare personnel on the number of individuals who are up to date with COVID-19 vaccines. Next slide. Before we discuss the new questions, we will review a few key terms that will be important for understanding the instructions for the new questions. First, we'll go over the difference between an additional dose and a booster dose. An additional dose is another dose of vaccine administered to people who are less likely to mount a protective immune response after initial vaccination. People who are moderately or severely immunocompromised should receive an additional dose. A booster dose is another dose of vaccine administered after receiving a primary vaccine series to enhance or restore protection which might have subsided over time. Next slide. Now that we have reviewed key terms, let's discuss the new questions on the resident form, indicated by the stars on the slide for the number of booster doses received. Please note that question 4 has not changed, other than no longer asking for the specific vaccine manufacturer. The two new questions are question 4.1, the number of residents in question 4 who have received only one booster dose of the COVID-19 vaccine since August of 2021, and question 4.2, which will collect data on the number of residents in question 4 who have received 2 or more booster doses of COVID-19 vaccine, and the most recent booster dose received since March 29th, 2022. Please note that March 29th was the date that the Food and Drug Administration approved of a second booster dose for individuals aged 50 and older. Therefore, NHSN would like to track how many individuals have received a second booster since this new approval was made. Next slide. In this example, we will discuss step-by-step how to report individuals who received only one booster dose. The first step, as shown here, is to make sure that question 2.2, any completed primary COVID-19 vaccine series, is entered. In this case, we've reported 30 individuals for question 2.2. Next slide. Next, in question 4, facilities report the cumulative number of residents with complete primary vaccine series in question 2 who have received any booster doses or additional doses of COVID-19 vaccine since August of 2021. In this example, we've reported that 25 residents have received any additional or booster doses. Next slide. And of the 25 residents reported in question 4, 15 received only one booster dose, which we've entered for question 4.1. Next slide. Now, question 4.2 asks for the number of residents who have received 2 or more booster doses, with the most recent booster received on or after March 29th. In this example, there are 5 residents who are counted in this category. Keep in mind that not all of those in question 4 may fall into questions 4.1 or 4.2. For example, some of those in question 4 may have received only an additional dose of the COVID-19 vaccine due to being moderately or severely immunocompromised and not yet received a booster dose. Next slide. Now we'll go over an important point about data reporting. If an individual was administered 1 or 2 doses of the COVID-19 vaccine after they completed their primary series, with no further details provided, then for the purpose of NHSN surveillance, assume these doses are boosters and not additional doses, unless you have specific documentation indicating that they are additional doses administered due to the individual having a moderately to severely immunocompromising condition. Next slide. We will now review how to report questions 4.1 and 4.2 among residents who have received an additional dose due to having a moderately to severely immunocompromising condition. If we go back to our previous example, where 25 residents received an additional or booster dose, we see that among these residents, 15 received only one booster, and 5 received 2 or more boosters, for a total of 20 out of 25 residents reported as receiving 1 or more boosters. The remaining 5 residents have received an additional dose, but have not yet received a booster. As previously described, these individuals are not captured in question 4.1 or 4.2. Next slide. In this example, we'll review how to report if residents received an additional dose, but no boosters. The first step is to review question 2, which is the cumulative number of residents who have received their primary COVID-19 vaccine series at this facility or elsewhere since December of 2020. In this case, there are 3 residents who received a complete primary series. Of these individuals, we report how many received any additional or booster doses in question 4. In this case, all 3 received additional or booster doses. Next, for question 4.1, we report how many individuals in question 4 received only 1 booster dose. And in question 4.2, we report how many individuals in question 4 received 2 or more booster doses. So in this case, 0 residents received boosters. This means all 3 residents included in question 4 have not received any booster doses in the time frame indicated by questions 4.1 and 4.2. Therefore, we report 0 for both of these required questions. Next slide. When reporting healthcare personnel COVID-19 vaccination data, facilities will report the receipt of any additional or booster doses in question 4, but will not be asked to report any other details on these additional or booster doses. As noted previously, we no longer ask about vaccine manufacturer, and questions 4.1 and 4.2 have only been added to the resident data collection form. Next slide. Now let's talk about the new up-to-date vaccination question added for both residents and healthcare personnel reporting. The image on this slide shows the new question on up-to-date COVID-19 vaccination status. Facilities report the cumulative number of individuals who are up to date with COVID-19 vaccines. We'll review the current definition of up to date on the next slide. Please note that this definition may change over time. Therefore, facilities should refer to the definition on the first day of the reporting quarter. The CDC NHSN team will be posting a document to the NHSN website with the current definition of up to date. And facilities should review this document at least once each quarter to check for any definition updates. Next slide. Individuals are considered up to date in 2 cases. The first case is when an individual received all recommended doses in their primary vaccine series and received 1 or more booster doses. Please note that an individual does not need to receive a second booster dose to be considered up to date at this time. And the second case is when an individual received all recommended doses in the primary vaccine series, but is not yet eligible for a booster dose. Individuals who are not yet eligible to receive a booster dose include those who received their second dose of a 2-dose primary series of Pfizer or Moderna vaccines less than 5 months ago, and those who received a single dose of the Janssen vaccine less than 2 months ago. You'll also note that there are 3 cases listed on this slide when individuals with a moderately to severely immunocompromising condition are considered up to date. Next slide. We will now walk through an example of reporting up-to-date vaccination status. In this example, there are 40 residents in the facility, and 30 of these residents have completed their primary vaccination series. Among these 30 residents with complete primary vaccination series, 26 are reported to be up to date with COVID-19 vaccines. The 26 residents who are up to date either received 1 or more booster doses, or they received recent primary vaccine series. As a reminder, refer to the table on the previous slide for the appropriate timeframes. Next slide. Now that we reviewed the definition of up-to-date vaccination status, let's discuss an example. In one scenario, Bill received 2 doses of the Moderna COVID-19 vaccine for his primary series. He later received 2 booster doses of the vaccine. His last booster was 7 months ago. The question is Bill considered up to date? The answer is yes. Bill is up to date with COVID-19 vaccines because he received a booster dose. Next slide. Here is another example. Anne received 2 doses of the Moderna COVID-19 vaccine. She received her last dose 7 months ago. Is Anne considered up to date? In this case, Anne is not considered up to date since she has not received a booster dose, even though she is eligible for it. Next slide. Now we'll review a few additional updates. There will be a new note added to the top of the weekly COVID-19 vaccination data collection forms about the 3 different ways that vaccination data for long-term care facilities can now be reported through NHSN. Facilities can continue to enter data directly into the COVID-19 vaccination modules. Facilities can also continue to upload weekly summary CSV files. Now there is a new method for reporting data by using the optional event level or person level COVID-19 vaccination tools, which are now built into the NHSN application for long-term care facilities to enter and manage person level resident and healthcare personnel vaccination data. Please note the application calculates and enters the weekly summary totals. Next slide. One final change we are implementing is that completing monthly reporting plans for COVID-19 vaccination modules, the long-term care facility component, will no longer be required. This has been done in order to simplify reporting for users. Instead, upon saving or uploading data, users will agree to the following, indicated in green on this slide. The data reported are consistent with definitions outlined in NHSN surveillance protocols, including tables of instructions and frequently asked questions. And the data will be sent to the Centers for Medicare and Medicaid Services, or CMS, to fulfill quality reporting requirements when applicable. Next slide. Now let's review some frequently asked questions and example scenarios. These will also be included in the frequently asked questions posted on the NHSN website. The first question is, how do I categorize a resident who received a complete primary COVID-19 vaccine series of Moderna vaccine with the most recent dose received 4 months ago? The individual is considered up to date because they received their second Moderna primary series vaccine 4 months ago, so they are not yet eligible for a booster dose. As a reminder, eligibility for a booster dose is based on how long ago you received your final dose of the primary vaccine series. Or if immune compromised, how long ago you received your additional dose. The individual would also be included in question 2.2 and question 5 of the data collection form. Next slide. For question 2, an individual received a complete primary COVID-19 vaccine series 5 months ago, but did not receive any booster doses. This individual is not considered up to date because they have not received a booster dose despite being eligible for it. This individual would be included in question 2.2. However, they would not be counted in question 4 as having received any booster or additional doses. If the individual was a resident, they would also not be counted in questions 4.1 or 4.2. Next slide. Question number 3 presents a situation where a resident received a complete primary COVID-19 vaccine series and 1 booster dose. This individual is considered up to date because they received a booster dose. They would be counted in question 2.2, question 4, question 4.1, and question 5. As a reminder, if this was a healthcare worker, the individual would be counted in questions 2.2, 4, and 5 only. Next slide. Question 4 asks how to categorize a resident who received a completed primary COVID-19 vaccine series in 2 booster doses. This individual is considered up to date because they received 1 or more boosters. They would be counted in question 2.2, question 4, question 4.2, and question 5. Next slide. Question 5 asks about how to categorize someone who received a completed primary COVID-19 vaccine series of Moderna and 1 additional dose a month ago due to having a moderately to severely immunocompromising condition, but no booster doses. The individual is considered up to date because they received their additional dose 1 month ago, so they are not yet eligible for a booster dose. They would be counted in question 2.2, question 4, and question 5. Next slide. In this scenario, an individual received a completed primary COVID-19 vaccination series and 1 additional dose due to having a moderately to severely immunocompromising condition, plus a booster dose. This person is considered up to date because they received a booster dose after their additional dose. They would be counted in question 2.2, question 4, and question 5. If the individual is a resident, they would also be included in question 4.1. Next slide. For question 7, an individual received a complete primary COVID-19 vaccine series and 1 additional dose due to having a moderately to severely immunocompromised condition, and 2 booster doses, most recently in April of 2022. In this instance, the individual is considered up to date because they received 1 or more booster doses after their additional dose. The individual would be counted in question 2.2, question 4, and question 5. If the individual is a resident, they would also be included in question 4.2. Next slide. In April, NHSN offered a few training webinars about the person level or event level COVID-19 vaccination forms. For those that may have missed the training or need a refresher, let's review a few main points about the forms. The person level COVID-19 vaccination forms are optional tools that can be used to report data to the long-term care weekly healthcare personnel and resident vaccination modules. These are available in the NHSN application, and SAM's Level 3 access is required. To request access, please email nhsn@cdc.gov and place SAM's Level 3 access in the subject line. These are new and improved versions of the Excel data tracking worksheets that are currently posted on the NHSN website. These tracking worksheets will be retired this month. Next slide. Data on individual residents and healthcare personnel are entered line by line in the optional person-level COVID-19 vaccination tool. And the application calculates the weekly totals for you and determines who is up to date based on vaccination dates. This is a major benefit of using the tool and can greatly simplify reporting. You must select the View Reporting, Summary, and Submit button. Choose the reporting week, review the totals, and then click Save and Submit to submit data to the weekly vaccination form. A refresher training will be scheduled for June of 2022. Webinar registration information will be coming out soon. Next slide. To learn more about the person-level COVID-19 vaccination forms, there are helpful resources available. The links on this slide will take you directly to the resources. Next slide. So let's summarize the main changes to the COVID-19 vaccination reporting forms that we reviewed today. The simplifications include that COVID-19 vaccination data will no longer be reported by vaccine manufacturer for questions on primary vaccine series and additional and booster doses. Questions on vaccine supply will be removed, and completing a monthly reporting plan to submit COVID-19 vaccination module data will no longer be required for the months beginning with June of 2022. Additions to the forms include adding 2 fields to question 4 to report cumulative number of individuals who received only 1 booster and 2 or more boosters of the COVID-19 vaccine for residents only, and adding a question for facilities to report the cumulative number of individuals who are up to date with COVID-19 vaccination. Next slide. We will now review how to access the additional resources that are available to facilities. The long-term care component website contains links to a variety of training materials, including quick reference guides, training slides, and information on CSV file upload. Next slide. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of your email, along with your facility type. This concludes the presentation. Thank you so much for your time.